Good morning, everybody. It is 7 o'clock. The widow who's won a change in the law, so people who kill emergency service workers will soon face mandatory life terms in memory of PC Andrew Harper. We'll speak to the Deputy Prime Minister and Justice Secretary Dominic Raab this morning about that. Plus, a warning that the rate of vaccinating children against COVID in the UK is just too slow. We'll talk to two top scientists about that, including the World Health Organization, plus the Shadow Education Secretary, Kate Green. Also this morning for you, you're going to be joined by former professional rugby league player Alex Popham to discuss why retired players are more likely to suffer poor mental health in later life compared to non-contact athletes. And oh, yes, they are. A Christmas panto with the Pritchards. We'll speak to our favourite Prince Charmings, AJ and Curtis, about their family pantomime Cinderella Spectacular. That's at 9:45. It's Wednesday, the 24th of November. Harper's Law mandatory life terms for those who kill emergency service workers under a new law triggered by the death of PC Andrew Harper.
And I'm here at the Ministry of Justice, where the government says it's on the side of victims. But what will this mean in practice?
Vaccine target, an accusation from Labour that some 12 to 15-year-olds won't be vaccinated until February, nearly 4 months behind target. A beautiful sister. A brother's tribute as two men are arrested on suspicion of murdering a teenager who went missing in Plymouth. An 8-year-old boy is the sixth person to die after a vehicle drove into a Christmas parade in Wisconsin as the suspect appears in court.
3, 2, 1. And liftoff.
Throwing targets into space, NASA's new rocket lifts off on a test mission to try to alter the course of an asteroid.
I'm live in the Ethiopian capital as the US warns that peace talks here are faltering. That as rebel fighters draw closer to this city, Addis Ababa, from the north.
Good morning, everybody. A law change in memory of a police officer who lost his life in the line of duty. People who kill emergency service workers will face mandatory life terms after the government backed the move following the death of PC Andrew Harper, something his widow has been campaigning for. They plan to introduce Harper's Law as soon as possible. Let's get the latest on that now from Milena, who's standing by for us at the Ministry of Justice. Hello to you, Milena. Very good morning. Tell us more about this.
Good morning, Kay. Well, you might remember PC Harper died in August 2019. He was responding to calls of a quad bike being stolen. And in the course of responding to that call, as he was getting after the getaway car, he got entangled in a rope that was towing this quad bike. And then he was dragged along the road for more than a mile, suffering catastrophic injuries and tragically dying. Now, his teenage killers were convicted of manslaughter. So they were not given this mandatory life tariff that normally comes with a murder charge. And since then, really, his family and his widow, Lissy, have been campaigning tirelessly to change this law. And now, with the change in law, anyone who kills an emergency worker, be it a paramedic or a police officer, in the course of committing a crime, will get this mandatory life sentence. Now, it's worth also noting this has sat slightly uneasily with some lawyers who say that you're now blurring that difference between manslaughter, which means you've killed someone without intent, and murder, which means you've gone out with an intention to actually end someone's life. But nonetheless, this is a victory, if you can call it that way, for the family of PC Andrew Harper in the wake of what was really a tragic event in their lives.
OK, Milena, thank you. And at 9:15 this morning, going to be putting questions on Harper's Law, this morning's other top stories as well, to the Justice Secretary and Deputy Prime Minister, Dominic Raab. To coronavirus now, and there's a warning that the rate of vaccinating children against COVID in the UK is just too slow. It comes as the government suggests new advice that you should take lateral flow tests before seeing elderly relatives and going into crowded places. Let's have a look at some of the main COVID talking points for you this morning. Here we go. Comes as analysis from Labour shows that some 12 to 15-year-olds may not be vaccinated until February. That's 15 weeks after the original October half-term target. Meanwhile, the government has advised the public to take a lateral flow test before spending time in crowded and enclosed spaces this winter, obviously shopping. And the lead scientist on the COVID study, that's Professor Tim Spector, last night told Sky News that COVID looks like they may stay flat in the run-up to the figures, may stay flat in the run-up to Christmas, but could get worse again in the new year. Rob Butler, Executive Director of the World Health Organization, is joining us now from in Europe, in fact, joining us now, as you can see. Very good morning to you. Thank you so much for joining us on the programme this morning. What's your overall take on what's happening with COVID as of today?
Thanks, Kay. Good morning. We're very alarmed. We have just surpassed, very sadly, the 1.5 million death mark last week. If we continue on the current course, we are projecting a further over 500,000, 500,000 deaths by spring next year. That's really worrisome. Of course, public health cost, the cost to our economies, the stress on our hospitals and communities, and our ICUs, of course, our intensive care units. So we're very concerned. We, in the European region, the 53 member states that WHO regional office here in Copenhagen serve, only 54% of the population of this region are vaccinated. So there's so much work to be done still. We're not there yet. And it looks like we're going to have a worrisome season ahead.
What's driving the resurgence of COVID in mainland Europe? Is it the fact, is it the lack of vaccines, or is it, as the guy who is the chief executive of AstraZeneca has said, the vaccines in the UK on the elderly the AZ vaccine worked much more effectively?
Well, it's partly due to there being too many vulnerable populations to infection of vaccination. Also, we're seeing waning immunity of these vaccines, especially around after the 30-week mark of the full course. Also, we've got, as I say, 47% of the entire population unvaccinated. And the unvaccinated, let me be absolutely clear, the majority of people in intensive care units and ICUs today are the unvaccinated. But there are other compounding factors, Kate. Winter. This is a seasonality observation we're making at the moment. People moving indoors, need for masks, a need for more ventilation. Masks, as you possibly saw from the British Medical Journal, the BMJ this last week, showed a study where 53% of transmission was prevented by mask use. We only have 48% of the population in the European region using masks. The moment we saw that go up, if we see this go up, we will see a reduction in cases and a reduction in deaths. If we saw 95% universal mask use, we could project that we would save about 160,000 lives. So this is a number of factors, plus the more transmissible Delta variant, which is accounting for about 99% of the cases in Europe today. That's why this is happening.
So wearing a mask would save 160,000 lives in Europe or worldwide?
Europe. If we saw 95% mask use, we'd see over 160,000 lives saved from the projection that you stated earlier.
OK. And just if I could take you back to the AstraZeneca line that we are in a lot of the newspapers this morning, Pascal Soriot suggesting that his vaccination, the AstraZeneca jab, being used on older people more here in the UK than in Europe, that is the reason that Europe is doing not as well as the UK is.
Well, I wouldn't start comparing different vaccines. I mean, all vaccines have been used in elderly populations. There are varying vaccination coverage rates across Europe. And that's why we're seeing this Delta variant, this highly transmissible Delta variant, find out these pockets of vulnerability and susceptible populations. I don't think it's useful that we go into which vaccine has done better where. What we need is every member of society vaccinated. And of course, those that are particularly vulnerable, the elderly, the healthcare worker, of course, healthcare workers are frontline, those that are immunocompromised, that they take a booster when they're offered one. This is also very important and will make a big difference.
Should we be travelling at the moment?
Travelling, but travelling safely. I'd like to think we're going to have a Merry Christmas, but a safe Christmas. So I think we all hope, as do my own children, hope that Christmas is on. We believe it is, that people will be able to travel. We hope that they will be able to travel. But I think a bigger question is how they behave when they travel. So again, mask use, physical distancing, hand washing, and adherence to those public health social measures will be so much more important over this coming season.
But we don't need to worry about travelling around Europe at the moment, given the numbers that we're seeing in Belgium and Germany and Austria and the like. And then obviously the travelling from the United Kingdom to Europe, the WHO still feels that that's acceptable?
Yeah, we think that the travel route should be kept open at this point, but the care should be taken. And of course, vaccine passports used where they're being used, where they're, I'm sat in Copenhagen, where I cannot enter buildings without my green pass. These passes, if you like, are actually providing us, enabling us to avoid lockdowns and remain able to move. So that's a very good thing that they're used and applied in many member states today.
You must be frustrated to read that the British government has destroyed something like 600,000 vaccine doses because they're out of date when they could have been shipped to countries that need them.
Indeed. I mean, what I think we keep explaining to our member states and try and communicate as clearly as possible is that we need to keep an eye on supplies. We need to make sure that there is equitable distribution of these vaccines, and that if countries plan to, for example, start booster campaigns, etc., that they are confident that they will be able to use the vaccines that they order, that they are provided, because of course there is only a finite supply.
And what happened? And your thoughts on throwing them away?
Well, it's never good to see a vaccine thrown away, of course, but this can't be avoided. If you don't have the demand for the vaccines, or your system doesn't allow you to present those vaccines, administer those vaccines, then of course they have to be thrown away if they're out of date, if they expire.
But presumably we could be in a position via COVAX where we can transport those vaccines. You know, if they've got the sell-by date on them, the use-by date on them, we can put them on an aeroplane and send them to Africa.
That's what we're promoting. I mean, where we can, let's see that vaccine solidarity across Europe and across the world. Indeed, I couldn't agree more.
And as far as the sell-by dates on these vaccines are concerned, we were speaking to our resident GP about that a little while ago, and he was saying it's different. Obviously, we can't use them after the use-by date. But how do we know that they're no longer usable by that date? Because they're a new vaccine. We don't know how long they're going to last. Do you have a view on that?
I don't really. I mean, good manufacturing and pre-qualification that WHO conducts on all of our vaccines basically suggest an expiry date as to the manufacturers, of course, and we adhere to that. These are new vaccines. So still a lot of, as you've just alluded to, a lot of studies still ongoing. A lot of science still to be found around the vaccines and their longevity. Of course, we're all hoping that we can see vaccines lasting longer, and of course the waning immunity that we're seeing at the moment. We need to tackle that because we need, of course, not to see that in the future. We need those vaccines to be powerful enough to protect us all in the long term.
Okay. Quick thought before I let you go. Where are you on compulsory vaccines?
Mandates compulsory vaccine. It's a healthy debate right now. I mean, mandatory vaccination can, but doesn't always increase uptake. There are lessons of history here where mandates have come at an expense of trust and social inclusion. So it's very delicate, but we believe it's time to have that conversation, both from an individual and also a population-based perspective. It's a healthy debate to have.
Okay. It's good to talk to you. Thank you very much indeed for joining us on the programme this morning. Thank you, Mr. Butler from the World Health Organization. Thanks a lot.
Thanks.
Quick look at the latest COVID data for you that we have this morning. 42,484 new cases of the virus have been recorded. 165 more people have died. The total of people who have died in the UK, 144,137. 23,258 people received their first dose of a vaccine in the last day. The number of people receiving their second dose, just over 18,500. 46.19 million people have now had both of their vaccines. What about the boosters? Well, the government did say they would be up at 500,000 a day, didn't they? That dropped to 308,000 yesterday, giving in the last 24 hours, taking the total number of those doses to 15.6 million people who've had their booster. Still to come on the programme for you, going to be speaking to the Shadow Education Secretary about new analysis from the Labour Party, which projects that some 12 to 15-year-olds will not be vaccinated until at least February. Joined by former professional rugby player Alex Popham to discuss why retired players are more likely to suffer poor mental health in later life compared to non-contact athletes. And we'll meet the 12-year-old boy who's raised hundreds of thousands of pounds for his local hospice by sleeping out in a tent for more than 600 days. Two men aged 24 and 26 from Plymouth have been arrested on suspicion of murder after a body has been found by police investigating the disappearance of an 18-year-old girl. Bobby Ann McLeod was reported missing on Saturday after she failed to meet friends in the city. Writing on social media, her brother Lee said, "I love you. You didn't deserve this." His Facebook post says, "Such a beautiful and talented girl, and to have you as my little sister, the adventure and journey we had been on will always be treasured. Now go rest easy." Last night, the Plymouth Police Superintendent gave an update on the case.
This is weighing heavy on the people of Plymouth tonight. It really is.
His last line
and I would like to just send my thoughts to the friends and family of Bobby Ann. We are doing our utmost and will continue to do everything we can to understand exactly what's happened around this event. When I've got any more details that I can share with you, we will do that.
This is a terrible story. An 8-year-old boy, sixth person to have died after a car sped into a Christmas parade in the US state of Wisconsin. Remember, we were telling you about that a couple of days ago. Jackson Sparks, here he is. He died in hospital last night, having attended the parade with his 12-year-old brother, who was also injured. More than 60 other people hurt. Several remain critically ill in hospital. Rest in peace, little man. The suspect, here he is, Darryl Brooks, appeared in court yesterday for the first time, charged with 5 counts of intentional homicide. It comes after the court heard he had previously been charged with running over the mother of his child in a domestic dispute. NBC reporter Jay Gray has the latest.
An 8-year-old who was injured during the tragedy here, along with his 12-year-old brother. His brother doing well, in fact, dismissed from the hospital today, but the 8-year-old succumbed to his injuries and died today. During the sentencing hearing here, or the announcing of sentences, of charges rather, against the suspect in this case, he faces 5 counts of homicide, as you talked about, likely to get a 6th added after this news today. He was in shackles and had a mask over his face. He's familiar with the legal system here and really across the country. He has an extensive background of violent crimes, including in 2020 firing shots at his nephew after they were in an argument. And then earlier this month, he is accused of punching the mother of his child and then using the same SUV that he used during what many here call an attack at that parade to run over her leg. So it's something that he had done before. There's a bit of back and forth. The DA here saying that he is very concerned that such a low bail was granted for him to be released from that arrest after he ran over the mother of his child. $1,000 was all that was required to get him out of jail. He left on a Friday, and the tragedy took place on that Saturday. So a lot of people looking into that.
Let's take a look at some of the other stories making news for you this morning on the programme. The Home Office should be stripped of all responsibility for the Windrush compensation scheme, according to a committee of MPs. The Commons Home Affairs Committee says it's discovered what it calls a litany of flaws in the way the system works.
Less than 30% of people who've applied for compensation have actually received anything. And it's around 5% of those who are most likely eligible for compensation have received anything. We've had the awful tragedy of 23 people having died before they got the compensation that they were entitled to. That's why we need urgent reforms to the system. We need to recognise what a terrible scandal the Windrush scandal was, and the obligation on the government to put this right.
A landmark case in the US has found that 3 chain pharmacies recklessly distributed massive amounts of pain pills in 2 Ohio counties. Lake and Trumbull counties blamed CVS, Walgreens and Walmart for not stopping the flood of pills that caused hundreds of overdose deaths. How much the pharmacies must pay in damages will be decided in the spring by a federal judge.
This is a landmark decision because it's the first time that the issues of opioid epidemic have been tried against these national chain pharmacies.
A rape conviction at the centre of an award-winning memoir by Alice Sebold has been overturned amid concerns the wrong person was sent to jail in 1982. Anthony Broadwater, who spent 16 years in prison, was cleared of raping Sebold when she was a student. Concerns came after a producer who was making the memoir into a film began questioning why the first draft of the script differed from the original writing. The man convicted of the murder of the British student Meredith Kercher has been freed from jail. Rudy Aguedi was released after serving most of his 16-year term. 21-year-old student Meredith was murdered in Italy in October of 2007. Sir Rod Stewart has called for the introduction of menopause classes for men. Quite right too. Just a warning, there's some flash photography coming up. 76-year-old singer is calling for the classes after watching his wife Penny Lancaster battle with severe symptoms. Sir Rod said classes would be a very good way to go to help husbands and partners better understand common symptoms. An investigation by Sky News has uncovered allegations that a gang of child abusers is allegedly at large in Hull. Police there have been urged to declare war on a child grooming gang after several women said they were abused by a group of men operating in the city. An investigation into the alleged crimes has gone dormant, but the UK's former top child abuse investigator has called for detectives to double down on the case after examining 1,000 pages of evidence.
It's not just he said, she said. We've got a number of victims saying, here's the pattern of behaviour, it's identical, and this is the person that does it.
Is your gut feeling that this case should be tested in court?
Oh, absolutely. I mean, if they need additional evidence, then go out and get it. We're almost at the point where we need to declare war on this type of behaviour. We need to say it is a priority.
And you can see more of that special report from our Home Affairs editor, Jason Farrell in Hull, throughout the day here on Sky News. You can check it out online as well. And we will be speaking to Jason in the 9 o'clock hour here on Sky. In the last hour, NASA has launched a test rocket on a mission to protect Earth from asteroids. The DART is flying to Dimorphos, which is a small asteroid moonlet, apparently. The target is not a threat to Earth, and it is in orbit around a larger asteroid known as Didymos. NASA says this system is a perfect testing ground for the DART. Hope you're taking notes at the back. In September next year, DART will crash into the smaller rock at 15,000 miles an hour. That's around 4 miles a second. The impact will change the speed of the asteroid by a fraction of a millimetre per second, changing its orbit, which will be closely monitored by scientists.
3, 2, 1.
liftoff of the Falcon 9 and DART.
This is the moment when DART set off on its journey to the asteroid. Our science correspondent Thomas Moore is with us now. Hello to you, Thomas. Good morning. This is pretty cool.
Yeah, look, I mean, Hollywood has had a go, hasn't it, with Armageddon and Deep Impact. Now it's NASA's turn, and they're doing it for real. But instead of a nuclear bomb, they're using spacecraft, it's about the size of one of those big washing machines you get inside a laundrette, weighs half a ton, and they're going to smash it into this space rock, which is much bigger. It's 160 meters across. But I hope that high impact speed, 15,000 miles an hour, is going to be enough to nudge it slightly off course. Now, as you say, this particular asteroid, Dimorphos, is not a risk to us, but there are probably lots of others out there that could impact the Earth at some point in the future. And let's face it has in the past. Just ask the dinosaurs. But it's thought that if you can nudge it off with a bit of time, you might be able to divert it enough so it goes round the Earth and we all live to fight another day. But it is something that NASA is taking very seriously as it's learning more about the number of rocks out there. It needs to find some way of just making sure that we all stay safe.
OK, thanks, Thomas. Thanks a lot. Fascinating stuff, yeah? Amazing. Looking at some of the other stories making the papers this morning. Here we go. Harper's Law, a mandatory life sentence for those who kill a police officer or a 999 worker, is the front page of the Daily Mail this morning. It comes after a campaign by Lizzie Harper, the widow of PC Andrew Harper, who was killed responding to a burglary. Do you remember that story? Bless her. So she's going to meet the Deputy Prime Minister later on today to talk about it in more detail. And we will also be speaking to Dominic Raab in the next hour. Also, the Express shows this photo of the Manchester Arena bomber, Salman Abedi, holding a mammoth machine gun. The paper says it was taken in 2011 in Libya. Twins killed as 46 perish in the holiday bus inferno. We talked about that yesterday, didn't we? Those are the picture of those two little boys. That's Luan and Album, just 4 years old twins. And they were on that bus that crashed and burst into flames in the early hours of the morning in western Bulgaria. Planets align. This stunning image shows Jupiter, Saturn and Venus above Stonehenge in Wiltshire, and it has gone absolutely viral. It was captured by members of Stonehenge Dronescapes who took 10 8-second exposures and merged them to reveal greater detail than can be seen by the naked eye. Now, I don't know which ones those are, but you probably do. Is it Saturn that's always the brightest? And Mercury's there as well, I'm guessing? Don't know. I'll find out. Mercury's in the middle, apparently. I think that's Saturn there, isn't it? And that one's another planet. Now, check. I love this. That's a bit woof, isn't it? How did he get up there? The owner of this dog looked everywhere for him. Couldn't find him, Carl Barrett's. Couldn't find the dog. He's only a puppy. Looking at the size of me, apparently he's still only a puppy. Looked everywhere around his mum's house in Cheshire. Went outside, had a look around the garden. Nothing. Where was he? Literally on the roof. How did he get there? They have no idea. But thankfully, the 9-stone St. Bernard turned up, and there he is. I have no idea how he got there. It's a great story, isn't it? Fantastic. His name? Samson. Of course it is. Now, how's this for a statement? A 10-metre floating earth created by international artist Luke Jerram has been unveiled at a beauty spot in Wigan. Visitors catch it at Pennington Flash Nature Reserve until Sunday. There you go. It looks very much like COP26, doesn't it? The earth that we saw there, I don't think it is, but it's... So just look how beautiful it is in Wigan. Told you, God's own country. Now, quick look at the climate dashboard, trying to protect that, of course. You can see the estimated temperature change compared to pre-industrial levels. This is now above 1.2 degrees. Under that is the estimated total carbon dioxide emissions. Most of this comes from burning fossil fuels and continues to rise. And then you can see on the right-hand side, should we see the real-time, actually, no, it's at the top, isn't it, today? The real-time power mix, that's from the National Grid, 47% gas we are using today. Using quite a lot of coal as well, actually, as it gets colder, 4.4% of coal. When we were up at COP26, that was down to 0. Keeping an eye on those numbers for you. A new stay indoors warning has been introduced in La Palma after the Spanish island was hit by fresh lava flows from an exploding volcano. Been keeping an eye on that as well, haven't we? Residents in 3 towns have been told to stay indoors, with officials warning of toxic gases spreading across the island. You'll know by now that happens when the lava reaches the sea, and then it creates that toxic gas cloud. People living in the capital, Santa Cruz, have been ordered to wear face masks for the first time because of high levels of sulfur dioxide. People living in the capital, as I said, told to wear those face masks. Quick look at the weather for you now.
Look forward to brighter skies. The weather, sponsored by Qatar Airways.
Colder this week is what we're being told. Some wintry hazards and very strong winds likely, especially on Friday and Saturday. Mostly dry out there now, but the north has some rain and mountain snow. It's chilly with patches of frost and fog in the south, mainly the southeast. Oh, look at those temperatures. Woof.
The weather, sponsored by Qatar Airways.
Where do you think the happiest place to live in Britain is? Well, apparently it's Hexham in Northumberland, according to an annual poll. The 800-year-old market town is said to have contented population. Harrogate, Richmond and Stirling were among the top 10 happy at home index. That's lovely, isn't it? How beautiful is that? There you go, cold outside, but we've got lovely pictures for you. Gorgeous, Hexham in Northumberland. Now, could we see any more COVID restrictions if cases rise throughout the winter? Coming up, we're going to be speaking to a member of SAGE. Stay tuned for more. World Health Organization has called for more mask wearing to keep COVID cases down. Earlier on the programme, the Executive Director of the WHO in Europe, Rob Butler, told me that more than 150,000 lives could be saved in Europe if more people wore face coverings.
If we saw 95% universal mask use, we could project that we would save about 160,000 lives. So there's a number of factors, plus the more transmissible Delta variant, which is accounting for about 99% of the cases in Europe today. That's why this is happening. We're very alarmed. We have just surpassed, very sadly, the 1.5 million death mark last week. If we continue on the current course, we are projecting a further over 500,000, 500,000 deaths by spring next year. Mandates compulsory vaccine. It's a healthy debate right now. I mean, mandatory vaccination can, but doesn't always increase uptake. There are lessons of history here where mandates have come at an expense of trust and social inclusion. So it's very delicate, but we believe it's time to have that conversation, both from an individual and also a population-based perspective. It's a healthy debate to have.
Well, Professor Paul Moss, who's from the Institute of Immunology and Immunotherapy at the University of Birmingham, joining us now. Hello to you. Thank you for joining us on the programme. Mandatory vaccines. Thoughts on that one to start with?
Well, we've seen in Europe this week, haven't we, the challenge that can impose. And we just heard from the colleague there about issues about trust and so forth. So I think we're quite away from that in the UK. We're starting to see it brought into particular workers, of course, in care services and health workers. So perhaps that's the approach that the UK will take. I mean, I think what the whole...
I didn't expect the World Health Organization to say that it's a conversation that now needs to be had. That obviously reflecting on the fact that almost half of people in Europe have not taken the vaccine, taken up the opportunity to have the vaccine yet.
That's absolutely right. Europe around 46% vaccinated. And I think, Kay, as you say, what we're seeing week after week is the power of these vaccines and how incredibly effective they are, particularly with this booster vaccine, the third vaccine. I think we perhaps felt that might top up our immunity, but it takes it to another level of protection, 93% protection against infection. So because the vaccines are so incredibly effective, that's why this debate is very, very active at the current time, particularly given this new wave.
Interestingly, the doctor from the World Health Organization, Rob Butler, also said to me that if we wore masks, if they were mandatory, then we'd save 160,000 lives in Europe.
Really interesting paper last week in the British Medical Journal showing that mask wearing does reduce transmission by around 50%. So there's strong evidence that it does work. Around 48% of people in Europe do wear a mask. And as you can see, if you increase that, that's where he projects those lives saved.
And what's your thoughts on the comments from the chief exec of AstraZeneca saying that his vaccination is better than others, especially with old people, and as a result, that's why Europe, who didn't use it as much as the UK, is not faring as well?
I thought those were very interesting comments, and my own group works very much on that area. I think UK has some different vaccine policies because we were the first, of course. We started in December last year, and therefore we saw the waning early, and we've exited this summer. Our policy was to create a longer term immunity during the summer, and I think that's given us the benefit. We had some other slightly different things about our vaccination. We extended the interval from 3 to 10 to 12 weeks, and that's going to give us, it seems, perhaps stronger immunity. As for the AZ vaccine, yes, our own work has shown it gives very strong cellular immunity, and perhaps in the long term that could be beneficial. But as Pascal Suarez said himself, we don't quite have that evidence yet.
If that's the case, why are the boosters Pfizer and not AZ?
Interesting question. I mean, I think the mRNA vaccines do give stronger antibody immunity, and that's really what people have depended on this summer. And so I don't honestly know why. Certainly AZ can be given, but the availability of the mRNA was just slightly better for boosters. The combination, by the way, of AZ and an mRNA is itself very powerful and could be something considered in the future.
And we don't know at this stage how long is a piece of string, but is it looking more and more likely that we will need to have boosters every year?
That's a credible, interesting question. I've just said that the third booster is great, but then the question is, how long is that going to last for? Do we need another one for 6 months? We just don't know. I hope not, that we will reach some plateau. Certainly against protection against severe disease, death, hospitalization, that should be quite long lasting.
Yeah, boosting people every 6 months is going to be a logistical nightmare, though, isn't it? Especially as we're hearing that some kids are not even going to get their first vaccination until February.
Yeah, it'd be unfortunate if we have to go that way. And as I say, although you might want to do that to get lovely antibody levels in the laboratory, I think in terms of protection, we will see that to be much more long-lasting.
And thoughts on kids waiting such a long time to have their vaccinations, and indeed vaccinating them in the first place?
I think we had that debate, didn't we, a few weeks ago? It was always delicately poised, and I think it was done because the consideration was given with children in mind. What was the best thing for them? We know that they have low risk of severe disease from the infection, and so to vaccinate them to protect the adults was always a moral question. I think we've got the balance about right in the UK, and I think UK vaccine policy actually has been very sound.
And the Israelis, though, I think, am I right in saying that in Israel, 5-year-olds are now about to be vaccinated, or certainly they've been given the authority to be able to vaccinate 5-year-olds. Are we going to go down to that age level?
Again, we're seeing the age limit coming down as we see learn more about the safety of the vaccines in children. So we may well get to that area. Israel's a very interesting case, as you mentioned. They were about the first country to get very strong vaccine coverage across the whole country. After the vaccination, there was a second wave, and then after the boosters, they're now under very good control again. So they're a model for what we can achieve.
Okay, Professor, good to talk to you as always. Thanks for your expertise, much appreciated.
Thank you very much.
Tamara is with us. Good morning, Tamara. Interesting that the World Health Organization is suggesting that we should have the discussion about compulsory vaccinations.
That's right. I mean, areas where we thought we would never go are now under discussion, clearly. Now, obviously, he was talking about all of Europe, and in terms of the vaccination rate, the UK very much leads the league tables in Europe. There are countries in Eastern Europe where vaccination rates are a lot lower. In Austria, where they've gone down this road of compulsory vaccination for everybody, the vaccination rate is only about 66%, which is one of the reasons they've had this big surge. So I think there's a lot to be said for the good place that the UK is in, according to all the scientists. That's the message you heard from Paul Moss there at Birmingham University. But after the government has already brought in that measure for care home staff and are bringing it in for NHS staff, they say, yes, the question is about where it goes and, of course, what might be the civil liberties implications. The message firmly from the government is they don't want to go any further than we have done at the moment. But, of course, things do change. We never would have thought that NHS staff would have to have compulsory vaccinations probably just a few months ago.
And masks wearing. Apparently, if we wear masks, more of us wear masks around Europe, will save 160,000 lives on the continent and the UK. And yet, we see our Prime Minister not wearing his.
That's right. So that figure comes from the British Medical Journal research, which found that masks are the single most effective public health measure. And if you increase mask wearing, this is across Europe, from about half to about 95%, then in theory that could save 160,000 lives out of the 500,000 that they think 500,000 people who it's projected will die between now and spring next year. He said it's alarming how many people are going to die of COVID across Europe over the next few months.
That's a third of lives could be saved if you wear a mask.
That seemed to be what he was saying, and he said it's so obviously it's a hugely important measure. In the UK, it is mandatory in some parts of the UK, but not in England. And of course, there is lots of debate about other measures like ventilation as well. But that is interesting research which showed that mask wearing is really the key.
Weird, when we went up to COP26 a couple of weeks ago, we were on the train from Euston to Glasgow. As you go across the border, there's an announcement on the train to put your mask on.
Yes, and mask wearing is very strong in Scotland. There are lots of pictures of people out and about. The government's guidance, interestingly, changed yesterday on testing, saying that up to now it has been that you have to test twice a week. Now they're suggesting that you might want to do a lateral flow test every time you go into a crowded space like Christmas shopping. Wow.
Goodness. And how long will they be free for? Another question to ask later on. For now, thanks very much.
Thanks.
Tomorrow's takes at 9 o'clock. Looking forward to it already. Meantime, the US has warned peace negotiators in Ethiopia risk being outpaced by an alarming military escalation. It follows Ethiopia's Prime Minister posting on social media that he will personally go to the front line to face armed rebels who are getting closer to the capital, Addis Ababa. Goodness me. Our Africa correspondent, John Sparks, with us now. Hi, John. Goodness me, that's quite a... Is it a threat or is it a promise? I'm not sure.
Good question. I think people are still struggling to understand the implications of all this. I think it's quite unsettled here in Addis Ababa. I mean, it's one of Africa's great cities, and I think it's sort of plagued with uncertainty now. People here were aware of the TPLF rebel advance, the TPLF from the region of Tigray. People knew that they were getting closer to the capital, but the fact that Abiy Ahmed, the Prime Minister, has gone to the front to lead the army, I think has made it real. It's made it more threatening, made it much more urgent. And on top of that, you've got foreign nationals from countries like France, Canada, even neighboring Sudan, their governments telling their citizens to get out of Ethiopia. So it has made the situation very real. I mean, as for Abiy Ahmed, we've seen or heard nothing official from him or of him at the front. And I was just speaking to his spokesperson a few minutes ago. She had nothing to add on this matter. But I think one of the worries will be that the fact that he's decided to do this will inspire a whole lot of other ordinary, so-called ordinary people in Ethiopia to go and join him at the front without equipment, without training, and that raises the worry about potentially huge loss of life. We do have international peace envoys like Jeffrey Feltman from the US shuttling between the various capitals. Yesterday he said he thought he was making progress, but that progress being rapidly outpaced by alarming military developments, he said. And I think the problem here is that both sides see a military solution to this. Both sides seek the elimination militarily of each other at the moment, and there's no impetus to sit down and talk.
OK, for now, thanks a lot, John. Thanks for explaining that to us. Could there be a link between contact sports and poor mental health? We'll talk to a former professional rugby player shortly. A new study suggests retired professional rugby players are more likely to feel depression and anxiety compared to non-contact athletes. Researchers from Durham University suggest there's a link between the amount of concussions suffered on the pitch and worse mental health in later life. Former professional rugby player Alex Popham with us now. Hello to you, Alex. Thanks for joining us. What do you make of this research?
Good morning. Thanks for having me. It doesn't surprise me one bit. I've been speaking to players over the last 18 months now who are in a really bad way, and on some instances I've had to get medical interventions and get them to speak to a professional because, unfortunately they've been suicidal.
Tell me about your experience, Alex.
I've been trying to help quite a few players and give them the advice after my diagnosis of what's been working for me, my diet, my exercise, get into a good routine, but that doesn't work for everybody, and that's where we've had to get professional help for them. That's the situation we're in, and as I said, it doesn't surprise me one bit.
Okay, but as far as, tell us about your experience when you were playing and the impact that it's had on you subsequently.
Well, whilst I was playing, it was just part of the game. We weren't educated on what concussion was. I've learned a hell of a lot over the last 18 months since my diagnosis. I always thought a concussion was where you were knocked out cold. I now know that 90% of concussions are where you're not knocked out. So when I was seeing stars almost every other day, that's a concussion. And this is where it's so important. And with Head for Change, the foundation we've set up, it's about educating people from grassroots all the way up until elite level, and to get the message out that this is important and players need to take it seriously.
I think I'm right in saying that you've been diagnosed with early onset dementia, Alex. How did it feel to realise that was as a direct result of playing a sport that you loved?
It was a hard one because it was in the middle of lockdown. We had the consultation over Zoom, and it gave us some answers to why certain things were happening, what I was struggling with. But I just wish, because the evidence was there whilst I was playing, I just wish we were told about concussions, because it was taken as a bit of a joke. If you had Bambi legs and you were all over the place, it was get up, you're not dead, get back into your defensive line. And things have got better, but there's still a lot more that can be done to protect these guys and women. Unfortunately, women are struggling too.
Yeah. Look after yourself, Alex. Thanks for taking the time to join us.
Thank you.
Good luck and enjoy the family. Thank you very much.
Cheers. Bye-bye.
Thanks a lot, Alex. Coming up, the Executive Director of the World Health Organization in Europe has told Sky News more than 160,000 lives could be saved on the continent if more people wear face masks, I should say. He also went on to say that mandatory vaccinations are a conversation that now needs to be had. I bet you've got a strong view on that, haven't you? You can tweet me directly if you would like to, @Burley, talking about it in more detail in just a few moments here on Sky.